take a seat.
Thank you, Miss.
Okay, Miss, good morning. My name is Fitria and I'm the pharmacist in this Brawijaya Pharmacy. What can I do for you?
I got this prescription from my doctor, and I want to ask about this.
Okay, Miss. Is this prescription is for you or others?
No, this is for my father's.
Okay, Miss. Could I ask you about 5 under 10 minutes about your father's disease and this prescription?
Yes.
Okay. What is your father's name
Mr. Danu,
and your father's age?
maybe 60 years old.
Okay, and your father's body weight
Maybe 70 kilograms.
and your father's body height.
170 centimeters.
Okay. Your father's address.
In Siguragura Street, Malang.
Okay, Miss, I will screen this prescription first, and then what is your father's problem?
He is losing his balance. His vision is blurred. He cannot move his right arms, and his face is asymmetric. Yesterday he slept in the bathroom.
Is there any past medical history?
He has high cholesterol and hypertension.
Okay, and then is there any therapy for that before?
Yes, he got simvastatin and hydrochlorothiazide, but he is not take the medicine regularly.
Then is there any allergic history in your father's eat drug or food?
No.
Uh, is there any family history?
Yes, my grandfather died because his diabetic mellitus was not controlled.
Okay. How about your father's lifestyle, like daily meal?
He liked to consume chicken gizzard.
Okay. Is your father smoke or consuming alcohol?
He is not consuming alcohol, but he smoked 1 pack per day.
Uh, how about his daily activities?
Actually, he just retired from his work as a teacher, so he stayed in his home every day and does nothing.
Okay, Miss. I will ask you about this prescription. Did your doctor tell you about the disease?
He just told me that my father got stroke.
Okay. Then, did your father tells you about how to intake the drugs?
No, he just told me that I get information from the pharmacist.
Then, uh, did your doctor tells you about course of therapy after take this medication?
No.
Okay. Uh, Let me check the availability of the drug, please.
Yes, I will wait.
Okay, Miss, I will tell you about the disease. So, like the diagnosis from the doctor, your father's got stroke. So, stroke is the damage of the brain caused by an interruption in the blood vessel, and the interruption of the blood vessels is caused by hypertension and the plaque. Now, the plaque is caused by your habit of your father that like eating the chicken gizzard. So I think this is the disease like that.
I told him every day to stop consuming chicken gizzard, but my father always told me that no problem here. It's so delicious for me.
Maybe your father didn't know what the effect of his daily meal, like eating chicken gizzard. So I will tell you about the medication, and then the first is Ramipril. So Ramipril is used to cover the hypertension, so the hypertension can be controlled, and this drug is can take 1 tablet in 1 day, and the dosage is 10 milligrams and can take in the morning. You can take it 1 hour before breakfast, and the side effect is cough. And then the second is atorvastatin. So this drug is used to cover the high cholesterol because it can affect the stroke, and it can take 1 tablet in 1 day at night. And the side effect is pain in muscle, but you don't be panic because it depends on the individual, and the dosage is 20 milligrams. And then the third is atenolol. So atenolol is used to cover the hypertension too. The dosage is 25 milligrams one tablet one day, and you can take it 1 hour after breakfast. And the last is aspirin. So aspirin is plaque stabilization, and you can take it 80 milligrams one tablet one day, and you can take it 30 minutes after atenolol. And this is the medication. Is there any question for the medication?
Okay, Miss, I understand, but I want to ask you, should my father take his medication every day?
Yes, your fathers must take all of this medication every day. And if you understand of all this medication, can you repeat how to intake the drug?
Maybe this is Ramipril
Yes.
and atenolol, and this to cover the hypertension. Ramipril is take 1 hour before breakfast, right, Miss?
Yes.
One tablet per day, and atenolol is take 1 hour after breakfast, one tablet per day, and this is simvastatin. No, Miss?
Yes, atorvastatin.
Oh, yes, this is atorvastatin to cover the cholesterol, and take at night
Yes.
one tablet per day.
Yes.
And this is aspirin. This is take 30 minutes after atenolol. Right, Miss?
Okay, right. And then I will tell you about the if the side effect is not be controlled, you can call me, and this is my contact number. And I recommend you to take all of this medication in the drug box, or avoid the sunlight, because it can affect this medication. And then you can routinely check your father's blood pressure and your father's cholesterol to the doctor. But if you have a tensimeter, you can check routinely your father's blood pressure. Is there any improvement or not?
Okay. What should my father do to treat his right arm so he can do these daily activities?
Oh, okay, Miss. You can move your father's arms through the exercise. So you can always exercise with your father's regularly. And then uh, I recommend you to your father's daily meal, like low fat and low cholesterol, because it can decrease the cholesterol and blood pressure. And your father should stop his smoking too. Okay, Miss, is there any question?
No, I think it's enough.
Okay, Miss, this is your medication, your father's medication, and I hope your father's get well soon. Nice to meet you, Miss.